everybody. Welcome to Your Capital What's Up. I'm Chuck Wiger, your area state senator. Thank you very much for watching. Today we're going to talk about issues facing the aging. And by aging, we're talking about senior citizens, and the definition for federal purposes of a program that we're going to describe is for people 60 and over. We have in our metropolitan area the Metropolitan Area Agency on Aging, and actually there's similar type agencies that look at planning for seniors throughout the United States. This started in 1973 through legislation, and it provides a very important service in terms of the needs and planning for seniors. To give us information about the challenges and services available to you or people that you know, I have the Associate Director of the agency, Bob Anderson. Welcome to our show, Bob.
Thank you, Senator Wiger. Nice to be here today.
Wonderful. And we'd also like to say that the agency, which is regional for the greater 7-county area, right. It's located in North St. Paul, so right in the area.
Right in the area, on the corner of Highway 36 and North McKnight Road.
Yeah, right near Target, among other places.
Absolutely, yes.
And
yes.
So we'll, as we further describe the services, we'll also say if people want to stop by, they certainly could.
Absolutely, yes, please do.
Well, I mentioned, Bob, that the agency that you are the associate director for is actually created by federal law, and there are agencies, I believe some over 600 or so throughout America, and 7 in the state of Minnesota, the one regional one which we're going to refer to now.
Sure.
But you have a charge from the government to provide certain services and planning for seniors 60 and over. So tell us a little bit more about what the expectations are, and then we'll talk about specific projects and services that are available to our listeners.
Certainly, I'd be happy to. Well, we have the state of Minnesota, through the Minnesota Board on Aging, has asked of the area agencies, or required of the area agencies on aging, that we perform 3 major functions. Okay. One function is our granting and contracting of, the majority is federal funding for various community-based services.
Okay, give us an idea. Okay, this is the first function for the granting for services for funding. What types of programs?
That could be programs such as transportation, family caregiver support services, both home delivered and congregate meal programs, chore services. So those are the various programs that we provide funding for. Okay. One other area that we're very proud of, and not to leave anyone out, but one area is our special access projects. We have 9 organizations that provide funding to minority-based organizations throughout the Twin Cities area, such as Vietnamese Social Services, United Cambodian Association of Minnesota, Hmong American Partnership, to provide services to their respective elders. A lot of that work is one-on-one. So that is one major component, is the funding of grants and contracts, and each year annually it's roughly about $6.5 million that we award out into the community. The second major component that we...
By community throughout the metropolitan area.
Through the metropolitan area.
And parts of that, based on your formula, would go to people in the East Metro, but it's dispersed on a rational type basis.
Right.
Okay.
You bet. The second service that we provide, or major program that we provide, is our provision of information and assistance. That is provided through our senior linkage line, which is a 1-800 phone number.
In fact, there's a magnet where if people want to get one and put it on the refrigerator, wherever. The senior linkage line,
yes.
1-800-333-2433. And I'll just read what you have, if our camera can pick that up. Your link to senior services and health insurance counseling. And I know many seniors, and actually non-seniors too, may have questions about health insurance and the maze of different requirements, but you provide guidance, counsel for people with questions on health insurance as well as other senior services. And then there's a website, www.minnesotahelp.info. And but tell us a little bit more about the linkage line.
Well, the senior linkage line is for our office, for our region. We have 12 paid staff members that answer phone calls from older adults, family members of older adults, professionals working with older adults. But we also have a cadre of approximately 100 volunteers that have been trained to provide health insurance counseling for individuals that are interested in wanting more assistance. Those volunteers are located and dispersed throughout the 7-county metro area. They either do home visits or they are located at community locations.
Home visits, potentially. So let's say someone's watching now, or they know someone that's got a question, senior related, whether it's health insurance or transportation or chores. Someone could even come out to visit.
Somebody could come out to visit. What we try and do is answer people's questions by phone first. If people are able to either come to the office or one of those community locations, that's the second best. For those individuals that are homebound and are unable to get out of their homes, we make arrangements to go out to their homes and sit and work through whatever questions or issues they might have.
Give us a flavor of the types of questions you have, and success stories and areas where sometimes you might not be able to help.
Sure. So much of the work, Senator Wiger, that staff and volunteers have played over the last many years have been dominated with Medicare Part D, the Prescription Drug Assistance Program.
Yes.
So we have a lot of people calling, first of all, to understand what are the various options they have available to them. So a lot of the work is that initial phone call coming in from someone and explaining their particular situation, medications they're taking, income level, health conditions, and so forth. What we will do then is we have access, staff and volunteers have access to the various plans that are offered for the Medicare Part D plans. We will narrow down and give that caller anywhere from 2 to 4 options that best fit their particular situation with options. I think that's what are the key pieces, is educating individuals and providing options to individuals. We don't point them and say, this is the best plan for you, but we'll give them an array of options, but try and narrow down what they have, and then assist them if they have additional questions. We'll let them then take it from there and make contact with those various plans. If they have follow-up questions, oftentimes we have 3-way phone calls. So we've got the consumer calling into the linkage line staff or volunteer, and then we're putting in making that third call to whoever is involved. It might be some staff person with a health plan. Sometimes it's around questions about Medicare benefits, Social Security benefits, so forth. So oftentimes we have the 3-way phone calls that take place, but a lot of the work that we also do is the follow-up work. Is we have provided that education or that information to an individual, and then it's following up with that person to ask them, did you obtain what you had called and inquired about? Are there any other services or assistance that we can provide help with? And oftentimes it's just letting them know that there is a person and a service available for them, for if it's a different topic next time, to please let them know that we're there for them. And so a lot of the work again is around Medicare Part D.
In addition to the health care, other types of issues?
It could be a question about services. Oftentimes it's an adult child calling from somewhere outside of Minnesota saying, Mom and Dad came home this weekend and it's obvious Mom and Dad need some additional services. This is their situation, and it's asking staff and volunteers what might be the best options for Mom and Dad in terms of they may need home delivered meals, or they are no longer able to drive and they need to get to their doctor appointments. Could be that they need, the caregiver could be living with Mom or Dad or brother or sister and saying, I need a break. I am providing, I am the primary caregiver. I need some time to just take care of myself. And so it may be looking at resources as to respite services. So it's a whole gamut depending on what the person is calling about. Each and every year, last year we received approximately 30,000 phone calls coming in through Senior Linkage Line and assisting people. So a wide range of services offered through Linkage Line.
Okay, and there is not a fee or a charge if you call
no,
and need services, or if someone comes out to your house?
It's a free service. With the Title III funds, there's always the availability
Title
of somebody...
III meaning it's a federal reference to what it's
Thank
called.
you. Yes. If programs that are funded with the Title III funds, there's always the opportunity for a person to donate if they would like, but there is no requirement that they do that. I think most of the programs and services that we award funding to, they understand what it costs them to provide this service, and they just educate their clientele and their communities in which they serve and say, this is a wonderful service, this is what we provide, this is the cost to provide it, and anything you can contribute to help offset those costs are more than welcome.
If someone maybe isn't quite sure of too much in terms of health care and coverage, and they have a lot of papers in a box and they're in binders, can they just bring them and say, help me?
We see a lot of that, and I would probably be in that same category with my father at times. It can become very overwhelming.
Yes.
And so staff and volunteers have been trained to carefully go through the various documents and assist an individual with whatever that situation is to help them resolve it.
Okay, it's a wonderful service. And you mentioned transportation. I know we've had cutbacks in programs. It's very important, especially the dial-a-ride programs we've had. How are you able to help if someone says, I want to be able to get to the market, or I have a doctor's appointment, whatever it is? How can the Metro Agency on Aging be of help?
Sure. Well, oftentimes when we will receive that phone call, the person will indicate where they reside and where they want to be transported to. We have MinnesotaHelp.info is a large database that we have information on a wide range of resources available to the community residents. This is available for everyone. And essentially what we will do is pull that information up and see Bob Anderson lives in the city of Woodbury and he needs to go to St. Paul Regions Hospital for an appointment. And this particular day we will look to see what service providers are available and what their requirements are to provide that service. Okay. I know transportation, as long as I've been at the area agency, has been a real challenge. We have had a number of our own service providers that have retired from the business. More recently, about 2 years ago, was the American Red Cross, and they provided wonderful services in Ramsey County, parts of Washington and Dakota. It was because of fiscal concerns that they could no longer operate that service, and so it has been a challenge to, I think, where we have found where we need to be looking collectively is how do we coordinate what services we do have out there, because transportation is one of those areas that to try and put your head around. I know I walk away oftentimes in meetings with a headache trying to understand why does this work in this manner and it's paid for from that pot of funds. And so I think that is a commitment of our own agency, is to understand better transportation services in the Metro and how we can help as a player in this to do a better job of providing those transportation services to people in need.
Sure, and you can play a very valuable role in advising regional policymakers as well as state and others that are involved in providing these, especially for people that would be transit dependent.
Yes, absolutely so.
Okay. For programs, let's say they're in their home yet and they just need some chores that might be done, and maybe they can't do it. There isn't anyone they might know. Sure. I understand that's something you potentially can be of help on. Tell me about that. Again,
we would encourage consumers, if that's a situation, your situation that you're experiencing, we would encourage you to call the 1-800-333-2433. introduce yourself and what your needs are. And again, if it's a chore service, if it's somebody to come out on a regular basis to cut grass, come out and shovel your walk or driveway in the winter months if that is needed, to let staff know what your needs are, and we will do our very best to match up who the service providers are, what options you have available to you, and give that information to the caller and help them, you know, provide at least the information. And then ultimately, again, it's up to them to decide what they'd like to, it's all about choice.
Right.
And deciding what works best for them and their particular place right now.
Okay, well, that's a lot of services that are provided. Any others that we haven't touched on that you'd like to share?
Well, Senator Wiger, the other area would be, we talked about the three major components with the Area Agency on Aging, and the third being around what we call it is program development and coordination. And essentially what that is, it's a planning component. And so what a lot of the work that we do is working with cities and counties and health systems and other entities that are providing services or programs to keep older adults in their homes. And an example that we have been very involved with over the last several years is what we call Communities for a Lifetime. Yes. Working with various communities that are preparing themselves to, they've had a population of individuals that have worked there, have grown up, have raised their families, would like to continue to live there, and offer a lot of value to the broader community. And so it's helping communities know that there are various things to think about in helping those individuals remain where they want to live. And it's not only the development of the infrastructure, but it's thinking about the services available to help people stay in their homes, and what are some of those factors that our older adults are facing to remain in their homes.
Has the Metropolitan Council addressed this in their development guide for the region? There's a blueprint, and I'm sure they're aware of the importance of you know, stability in the community where people can stay, or maybe they graduate to different housing options. But that would be a good thing in terms of the transit and other aspects that the planners are involved in to make sure it's sensitive to the needs of seniors. Because after all, as we know, the fastest growing block of the population would be seniors. And another quote that I hear is, there will be more seniors in the population by 2020 than there are students in high school or in K-12.
That's right.
So,
and I think that's
the trend, and we need to prepare now.
Yes, and I think that's we've been very happy to be working with. We know that North St. Paul, the West St. Paul area are very excited and interested in, they've already taken steps to development or prepare themselves for their older adult population. And there are a number of other communities that we have had interaction with and discussions with, not only for elected officials, but I think it's also the staff themselves. It's not only roads and bridges and sidewalks and buildings, but it's a whole lot more. So it's been a learning process for us, no doubt, to understand how cities and communities work. But it's also been we've been well received, and I think we have a number of great coordination efforts underway. But I think those will be some over the next year or two, some great examples that we will carry further and exemplify with other communities, thinking about, yeah, I guess our communities are getting older, and we want to make certain our residents remain in our communities to offer their services and their value. And so the hope and the belief is that as that aging population grows older, there will be more and more communities that say, we need to know more, we want to know more, we want to prepare for that aging population. Good.
For the programs that you put together, you have an advisory board, I believe, that oversees everything that you do. Tell us a little bit about the structure of the agency. You have the wonderful services that are available that we described. But then how is this all
governed?
Set the governance. You have the federal law. There's some state money involved, but give us an idea of the big picture here as well.
Sure. Well, our organization was part of the Met Council up until 1994, and now the MAAA, as we call it, the Metropolitan Area Agency on Aging, is an independent, nonprofit, private organization. We have 19 board members on our board, and we have on that board a representative or a county commissioner from each of the 7 counties.
Okay.
And then on our board, we are required by federal law, the majority of board members have to be older adults, 60 years of age and older. Okay. And so we have a nice mix of, as I said, county commissioners, but also working individuals that are under the age of 60, but also retired and working individuals over the age of 60. So professionals, attorneys and nurses and physicians and finance people. So we've a wide range of individuals representing different parts of the 7-county metro area. As you said, a lot of the requirements and the mandates placed on our organization and subsequently asked of our the recipients of our funds. The majority of our funds, and I would say approximately 80 to 90% of our funds, are federal funds, and we call them Title III out of the Older Americans Act. But we do have a smaller percentage that are state funds, and as we talked earlier, some of those funds are used for, are available and used for the provision of prescription assistance program through Senior Linkage Line, but some of the state funds are also used for home-delivered meals, congregate meals, as well as grocery shopping and delivery assistance services. So we have some latitude with those state dollars, and that's how we utilize them.
And the 19-member board, county commissioners, others, majority seniors, which is a very nice mix, and all of the hundreds of volunteers that you must have to make this operation possible. This board meets once a month, or? Generally
once a month. We, out of a year's time, we usually meet about 9 times a year. We have various committees. We have a planning committee, which I am a staff person of, and a lot of what we develop for funding policies as we move forward and award dollars out, we take a lot of our work through the planning committee, ultimately comes up through our board for approval, and then we put out what we call as those requests for proposals. We had an applicant conference this morning for our chore services, and so of course anybody and everybody that's interested in applying for those funds comes to that, and we work through the applications and the budgets and all the paperwork that goes along with those dollars.
Okay, and is there a website for the agency?
Yes, it's www.tcaging.org.
Okay, we'll say it one more time, a little more slowly.
Okay. www.tcaging.org.
Great. And so to find out more about the agency, the work of the board, there's a chance there too, in addition to calling, but you could by email, because we know
of course
people of all ages are emailing now.
Yes, so it's really neat to see people of all ages that have become very sophisticated with emailing and using Facebook and all sorts of the new ways of communicating with one another. It's been great.
And how many staff are there at the agency?
We have approximately 43 individuals that are working at the Area Agency on Aging.
Very good. Well, with all those programs, I can see how that number is definitely needed, and with the volunteers to help get that fully implemented for what you're working on. If someone has some suggestions, recommendations, I assume you would invite them to contact the agency? They
would be more than welcome to contact the agency, or you can certainly contact me, and my number is 651-917-4649. I'd be happy to speak with you, and my email address is bob@tcaging.org.
Wonderful. You mentioned, Bob, earlier you want to provide choices. When someone calls, and it could be any number of issues when they call that linkage line. And I'm going to repeat that again, the linkage line, 1-800-333-2433. but they call and they can be given some choices, possibly a follow-up visit to the home. We also have advocacy organizations out there, as you know, whether it's ARP, the Association for Retired Persons, the Senior Federation, other groups. Do you meet with, are the senior interests coordinated, if you will, with various groups, or are you all different?
I would like to think, depending on the initiative that's underway or the planning work, that there are multiple reasons that I feel very fortunate to be working at MAAA, but one is the partnerships and the collaborations that we have with just a wide range of organizations, and anyone that's interested in providing services or interested in older adults. I think we have the wonderful opportunity to meet with a lot of organizations. There is a Minnesota Leadership Council on Aging group, and MAAA is one of them, but there are a number of organizations that are participating, and what those service providers there, it's not looking at just the metro area, but it's looking at services, community-based services essentially, for older adults throughout the state of Minnesota. And it's trying to discuss and understand and bring forward to our state leaders some of those issues at hand that are important to older adults. And a lot of what our work has been over the last several years has been understanding what it requires to help an individual and his or her family remain in their communities, knowing that I think most of us, if not all of us, if we had our choice, would like to stay where we're at right now. And if services or programs or whatever else is needed to keep an individual at their home, that's what we want to have. So,
and Bob, we're almost out of time, but I wanted to ask as well, seniors are more vulnerable to scams, and there's bad things that happen out there, as you know. Does the agency provide referral or information if someone maybe has responded to a very suspicious email or call or person asking for money or to provide a service?
If an individual has experienced that, not only could you call the 1-800 Senior Linkage Line phone number, but you could also call your local law enforcement agency and let them know of what has just happened or occurred, or what you believe to have happened. But certainly you could call our agency, and we do share contact information of where you can go to receive that assistance, and also in some instances forward on that same concern with others.
Okay, Bob Anderson, Associate Director at the MAAA, the Metro Area Agency on Aging. Thank you very much for joining us, and we invite our viewers to contact the agency if there's questions, and we commend you for a job well done.
Thank you very much.
And viewers, if you have questions you'd like to share with me, give me a call at the Capitol. It's 296-6820, or my cell phone, 651-770-0283. For Your Capital What's Up, I'm Chuck Wiger. Thank you very much for watching.